Welcome, action taker. I know hundreds of doctors would have seen the video, but only few take action. And now you know the reason why few people are successful and many people fail, okay, in the clinical exam or in the real life, because people take action. And someone like you who took action need to be benefited. I like helping people who take action, and that's why I want to teach my three secrets in these three videos. Okay, these are very important. Let me tell you a story before I teach you the secret one. Okay, so this story is called the Goldmine Formula. This is the story of two friends. One was extremely successful in life and one was only successful a bit. Okay, the reason why the person who was extremely successful was um, there was a reason. He was persistent, he had patience. And let me tell you the story. So these two friends went to this place where they found gold. Okay, so the first person who was extremely successful started digging for gold and he found some gold. Then he started digging more. He found more gold. And he started digging more and he found more, because gold is usually seen in veins. Okay, so that was the reason why the first friend was successful. The second one, what he did was he was digging, he found some gold. Then he took that gold, then he went to next place, he started digging. He found some gold, he went to the next place, then he started digging. The reason why this guy did not make too much money like the first one is this guy was moving from one place to another place. He was not persistent and he was not patient. Okay, that's very important. To be successful in life, you need to be persistent and you need to have patience. The same thing applies to our clinical exam as well. When I was an examiner for a mock exam recently, I've noted that the only difference between people who were able to finish the exam on time and people who were not able to finish the exam on time was if they were asking open-ended questions or not. Okay, so that comes to our first secret, asking open-ended questions. I will teach you the strategy at the end of this video, but I want you to learn the concept now. Okay, so the key was the students who were asking more open-ended questions were able to save a lot of time because they were able to listen to what the patient is telling. They were showing empathy towards the patient. They were understanding what the patient was telling. They were talking less, so they were making less mistakes. And the other people who were bombarding the patients with multiple closed-ended questions were wasting time, because they were bombarding the patient, they had to ask a lot of questions, and they were doing lots of mistakes during this process. And this is the reason why the people who were doing less by asking only open-ended questions were able to finish the station on time, while the people who were doing more by asking too many closed-ended questions were wasting their valuable time in the exam. Let me give you an example. Let's say a 75-year-old male has come to you complaining of a cough. Okay, if you are smart, you will ask more open-ended questions and let the patient talk. And all you need to do is show empathy. When the patient says, "Doctor, I could not sleep for 3 days," you say, "Oh, I'm sorry to hear that," or "It must be really tough on you, John." Okay, so all you need to do is when they say something like that, you need to show empathy to the patient. That's very important. Many people don't do that. Okay, all they say is okay. When the patient says, "Doctor, I was not able to sleep for the last 3 days because of the cough," many students I've noted will say that, "Okay, tell me more about whatever it is." So they ask the next questions. So show empathy. When you ask an open-ended question, listen to what the patient is telling, and based on their answer, show empathy, and then ask another open-ended question. I will teach you the 5-step formula at the end of this video, but let me give you more examples about this. Okay, so let's say a 15-year-old girl has come to you with earache. Okay, so first thing you do is ask open-ended question. How can I help you today? That's step one. Okay, the patient will tell you, oh, doctor, I have this earache from 3 days, and most probably she will stop because she is clearly instructed by the examiner not to give too much history when you ask for open-ended questions. So when she stops there, many people will bombard this little girl with multiple closed-ended questions and waste their valuable time. And that is the recipe for disaster. You don't have to do that. You don't want to do that. You want to ask another open-ended question. Tell me more about the earache, Sandra. Okay, then the patient will start giving, oh, doctor, the pain started 3 days ago. Initially, it was not bad, but now it's getting worse. And I was not able to sleep last night. Okay, she will stop there. You show empathy first. You say, oh, Sandra, it must be really tough on you. Okay, so then you say, you ask the next open-ended question. Okay, so that's what you need to do. You need to let the patient talk, sit down, listen, and show empathy, appropriate empathy and appropriate rapport techniques with the patient. That's the key to pass the clinical exam. Not saying like this, oh, which ear is it? Is it the right ear? Is it the left ear? When did the pain start? What were you doing when it started? Is it getting better, worse, or just the same? Instead of asking 5 questions, if you ask another open-ended question, like tell me more about the earache, the patient will tell you everything. The same applies to cough. If someone comes to you with cough, the first thing you need to do is, how can I help you today? Then they will say, doc, I have this cough from 2 weeks, and most probably will stop there. Then you ask second open-ended question, which is, tell me more about the cough. Okay, so that's step 2. Step 3, after they finish talking about the cough, step 3 is what else. Okay, so this is very, very important, guys. You need to ask the patient what else. Then the patient will give you a bit more history. Doctor, let's take the earache girl. She will say something like this, doctor, today I have noticed some discharge from the ear, and I have some fever as well. Okay, then you don't stop there. You ask another open-ended question, which is anything else. Okay, that is step 4 is anything else. You don't bombard patients with closed-ended questions. You will ask the patient open-ended questions and you will just listen to what they're saying. While they're saying something, you get your next question ready or you think about your differential diagnosis. That's what I was doing, and that's the only reason I was able to pass all the 16 stations of my clinical exam, and that's the only reason I was able to finish most of my stations before 6 minutes. I was having 2 minutes spare time for each and every station when I took my clinical exam. Except one station, I finished every station before 6 minutes. The reason is asking open-ended questions and lots of other secrets I'm going to teach in the next few videos. Okay, so that's step 4. Step 5 is tell me more about the positive finding is step 5. In this case, the girl said she had discharge from the ear and she had fever. Okay, so these are the 2 positive findings you got in the history by asking step 1, step 2, step 3, step 4. Okay, so you ask another open-ended question about the positive finding, which is tell me more about the discharge. You remember the girl said she had some discharge from the ear? Yes? Okay, so you need to ask open-ended question about that. And if you remember, the girl also said she had some fever. So now you ask open-ended question about the fever. Tell me more about the fever. See there, you got a lot of history. This is how you dig the gold. You are not running from one question to other. You have to be patient, you have to be persistent to be successful in life, and to be successful in the clinical exam, you need to ask open-ended questions. You need to keep digging on the same place where the patient is going to give you history, which is gold for us. And you save a lot of time because you're not talking much, you're not committing the mistakes, you're just listening to what the patient is telling you, and you will be thinking about your next questions. Okay, that's secret one, guys. So let me recap what all we have learned in this video. We learned 5 steps. It's called the 5-step formula. This is the first thing you need to do when you enter the room. After you greet the patient, you need to launch the 5-step formula. Okay, this is very, very important. If you don't use this, you will easily save 1 to 2 minutes. You will lose 1 to 2 minutes of your valuable time because you're asking too many closed-ended questions. The patient has to think about the answer and tell you the answer. Then you have to ask next closed-ended question. Then the patient has to think and give you answer. Then you have to ask another closed-ended question. Instead of that, just focus on these 5 open-ended questions. Step 1, how can I help you today? Step 2, tell me more about the symptom. Step 3, what else? Step 4, anything else? Step 5 is tell me more about the positive finding. Okay, so I hope you got what I mean to say in this video, and I will see you in the next video, which is about being organized. This is one of the important technique I've learned, and this is another time saving strategy. So make sure you listen to video 2, which is being organized, and that's the secret too, guys. I hope you love this video, and you will love the rest of the videos as well. And thank you for being an action taker. I like to help people who take action, and I will see you in the next video.